instead of allowing them to continue mourning and get closure through even a burial process, as is our custom, you hold the body, and this is really not right. Now, I think we should also look at what pushes these hospitals to hold the dead bodies. I will not defend these hospitals, but we need to look at that. What compels them to do this? How can we assist so that, like some members were proposing, is there a way we can have a proposal that is, like even installment payments that can be guaranteed so that these hospitals do not resort to that? The other thing, as members, we encouraged our constituents, our people, to register for SHA. I heard a member here say that as civil servants, we pay monthly, and for hustlers, they have a one-off pay. It's not correct. Actually, the president launched Lipa SHA Pole Pole. That is for hustlers. So we are continually giving wrong information to the members of the public. We do not have a very robust social health care scheme, and then we end up with the challenge that brought the spirit to this bill, which is very important. But as members, let us encourage our people to register for SHA. In fact, for me, just now, I responded to a message, a distress call, and the first question I always ask, in Mbeere North, have you paid for SHA? I'd rather help you pay for SHA than pay a big hospital bill later. The other thing is on doctors' charges. I know it's a really emotive issue, and unfortunately, as doctors become better, with the more experience, they end up charging more. And I think it's more of a willing buyer, willing seller, or willing healthcare provider, and willing service recipient. So I would want us to be careful when we discuss doctors' charges, because we may kill innovation. There are some doctors we pay for medical conferences to be updated. They want to give you the best healthcare, and they will not charge you the same as the same doctor who, since graduation, maybe has not gone, to update. Although I must thank KMPDC, because they have CPD points, they have CMEs to encourage doctors to go for that. So I want to urge this House to consider really funding healthcare. I know it's devolved, but we need to fund our healthcare so that even as we talk of waiving bills, then we have a recourse for these institutions, because they will waive bills. Again, patients will go for healthcare for emergency, requiring emergency service, and the hospital says we have no gloves, we just have a doctor, and the doctor cannot really respond without the tools of trade. So we have to look at a way where we package this to protect the patient, to protect the dignity of dead bodies, and also protect these institutions. I support this bill, and I want to encourage us, because this conversation is really, most members I can see have had an input on this, and we want our healthcare to be the best, and I can say we have a good, as government, government is putting measures to ensure that we get there. Even the referral system, whereby, like in my constituency, I encourage a patient. Even just the other day, a patient came to me. They had a tumor. I told them the best thing for you to do, you have SHA, go to your dispensary, follow the referral system. When you follow the referral system, SHA takes care of your bills. But what some patients do, they go to the referral institution, and that's why you have cases where patients will tell you, SHA is paying this amount and I have to foot the other bill. So we really need to educate the public, and that's our role, so that SHA succeeds. It is in our interest. We are carrying so many burdens. I'm just new in this house. I can imagine what you have gone through. There are two members of parliament who are here for a longer time, even 2-3 terms. If you are shouldering all these bills that I've encountered in the few months after election, I really say we need to support SHA so that some of these issues can be addressed. I support this bill. It is timely, and I congratulate the member, and I hope that by the time the term for this House expires, we pass this bill. I support.
Member for Kericho. Who are the member for the Honorable Jane Kiara?
Okay, thank you, Honorable Speaker, for giving me this opportunity. And Honorable Speaker, on the onset, I want to support this very, very important bill. That is the Health Amendment Bill of 2024 by my colleague and my friend, Honorable Njeri Maina. Thank you for bringing this very, very important amendment. And even before I talk about the bill, I want to thank the member who has just spoken. And I want to thank him. As much as he's saying he's new in the House, he has actually added value. And it is not only for the first timers or those who have been here for long who feel so much about the bill, I mean about the issues of paying for our constituents. It is all of us who feel for the same. So, Honorable Speaker, I want to say that this bill is so important, but it has delayed from 2024 up to date. It has taken long. As much as, and we appreciate the fact that it has been a process, and especially the SHA, changing from NHIF to the SHA, which addresses quite a number of issues. There's still this gap that we have here, and I am so happy that this bill is addressing the issue of prepayment before emergency medical treatment is provided. Honorable Speaker, I'm saying this because we actually have so many people who lose their lives, maybe in a scene of accident, and mothers who go to deliver and they are not attended. Some of them in the emergency, some in the scene, and others in the emergency area because they are waiting for the pill to be put. And it is very, very sad that lives are lost, yet we are supposed to save lives. And Honorable Speaker, you will also realize that many of these, the patients who go through this process or who actually serve at this come from humble background. The only thing they have is a piece of land, especially from where I come from in Kericho. But this piece of land is not even in their names. The title goes to even 4 generations behind.
Now, who is this now? The Honorable Osero. Is that you?
Okay, thank you, Honorable Speaker. So, in other words, Honorable Speaker, it takes very long, it takes days even to admit a patient. It takes hours even to take them to, if it is an emergency for cases of surgery, because they have not paid anything. And this is where we lose lives. Others even goes to a point of being disabled because they have not been saved early enough. So, Honorable Speaker, Article 26 of the Constitution tells us about the right to life. And if, Honorable Speaker, every member of this country has right to life, then it means lives must be saved. And this bill is actually sorting that one out. And Honorable Speaker, it is also very, very important to note that this bill addresses the issue of it restores dignity even in death. I'm saying this especially when it is addressing the issue of dead bodies being retained in hospitals. Mr. Speaker, this has affected me personally, and especially cases where we are asked to go for fundraisings. We raise money. I remember last year in one of the wards, Kapsoit ward, I attended a fundraiser, and members of the community did fundraisings for many, many months, and they were not able to raise 6 million. And then, Honorable Speaker, this mom was retained in hospital for days and days. We did fundraisings. I had to go around ministries asking our PSS, our CSS to help. So it is very frustrating. It is also affecting families. It is shameful. It also takes a lot of time, takes a lot of resources, knowing that in my community, Honorable Speaker, we actually respect the dead. So if they stay for even 4 months, nobody will go to work. Nobody will go to the farm, especially the immediate family members. They have to stay around until the death is buried. So it is actually something that has affected many. And Honorable Speaker, as I've said, depositing of title deeds will only influence to some extent, but noting also that the mortuary fee is not also paid by SHA is another frustrating issue. So the bills will accrue every day in, day out. And it is not only affecting the family members, the community is affected because nobody would actually feel lifted or free until the dead are buried, Honorable Speaker. So in this case, I want to appreciate this bill and say that it is important to have these amendments done so that even the dead are buried honorably. Time is also of essence. It is also important to know that even hospitals will have their rights preserved. Honorable Speaker, as I say this, I want to also put across this point that health being devolved, our counties must do something, and especially in cases of providing medical attention and medical services, and especially equipping the ICUs. This is where we have issues. Equipments should be provided, drugs should be provided, and especially in the level 4, 5, and 6 where necessary. Otherwise, we are losing lives. Mothers have also lost their babies because of the emergency CS that is not done. The doctors also need a fee. And Honorable Speaker, you can't tell our people that you cannot afford to go to a private hospital and therefore can you go to the public? Because they are so concerned, they want to save their loved one and they are not able to pay. So this has caused a lot of issues and a lot of chaos within us. It has also led to separation of families. A mother feels maybe the father of this child or whoever is not actually doing much, doing enough, yet in the real sense they are not able to do. So I want to support this bill and say that it should move as fast as possible. And Honorable Njeri, I wish you can advance it, and so that as much as it is a private bill, it can be adopted in this House, and I request and ask the members and appeal to them to support this bill because it will save all of us, Honorable Speaker. With that, I truly support and thank you very much.
Member for Naivasha.
Thank you, Mr. Speaker, for giving me this chance to support this amendment bill by Honorable Njeri Maina. At the same time, congratulate her. Njeri listens to the ground, so she knows the problems that the country is facing. On the onset, Mr. Speaker, we must agree that our health sector is collapsed. It's collapsed, starting from payment of doctors, equipping hospitals. Mr. Speaker, we may pass this bill, but as long as the hospitals are not equipped, the doctors are on the streets demonstrating because they have not been paid, we must first and foremost think where the rain started beating us. I've heard members talking about SHA. I still believe SHA is not working. Yes, they have to deposit 6,000 for 1 year. Honorable Amudhen, they're telling us that the president said that you can pay pole pole. I want to tell him this is what, Mr. Speaker, we used to call roadside declarations, because government works with gazettement or policy papers, not on the street. Mr. Speaker, detaining dead bodies is the worst thing that you can do to a family. Mr. Speaker, I know there is a body that was detained in KU for 7 months from my constituency for a very poor family to pay 9 million. They raised funds. It was never enough, not once, not twice. Eventually, Mr. Speaker, I wrote to the CEO, I'm not a family member. I told them, bury that body. I don't have the consent of the family, but it was so painful. Eventually, the body was released when they realized there was no money, more money coming. Mr. Speaker, there was another one. They had done 3 harambes, and the money was not enough, and their title was in the hospital. I wrote to MP Shah, thank God, they got the title released. So if it is not flowing, somebody has to step in to get things to work. We must agree that we have a problem. Members of this parliament, we are all doing those harambes, and we have done them for the longest. So if there are people who should support this Honorable Jerry's bill, it's members of this parliament. It's so painful when a patient has been discharged, but they cannot leave the hospital because of an unpaid bill. Yet, the bill keeps on accruing. These are the things we say. If the health sector is not properly administered, members of parliament and families are going to suffer. Mr. Speaker, I remember when Honorable Sabina Chege was the chair of health, I used to call her all the time to get bills waived. You know, Kenyatta Hospital is a referral hospital. And what happens is that a patient is sent to Kenyatta with the family not knowing, because the patient requires specialized treatment. So they are brought to Kenyatta. Then they die in Kenyatta. The patient, the family, to get that body out of Kenyatta is another burden to the family. Mr. Speaker, we have had very many cases where patients go, they are treated, they require medicine, but they have to buy it outside the hospital because there's no medicine in the hospital. Services like X-ray, they have to take it from outside. That's what I'm saying. This is a sector that needs overhaul and being looked after. Mr. Speaker, we have had cases where a patient has to be referred to Kenyatta, as there's no ambulance. Or if it's there, it has no petrol. We have all sorts of problems in the medical sector. Mr. Speaker, emergency. Sometimes there's nothing these doctors can do because there are no equipment. A patient has come, they need this item, they don't have them. So that's what I'm saying. We need to overhaul the health sector. Pay the doctors well, equip the hospitals, so that an emergency is an emergency and it can be treated as such. Because we have had kids or mothers delivering at the casualty. Not once, not twice. We have had mothers lose their babies and they cannot take them home because again there's a bill to be paid. So it's double punishment for families. Here you are, you can't pay that money, yet the person, your patient, is dead. Mr. Speaker, I have a harambe like this that we have to do tomorrow of a body in the hospital. These hospitals also have a problem. You call the doctor and you tell them, please, I want a waiver. Mheshimiwa, what do? We have to run this institution because there's no money. And then during these very hard times, economic times, when families have no even food to eat, and unfortunately, a disease knocks on the door, maybe that emergency. We are living in a very sad state in matters of health. So, Mr. Speaker, I will join all of us in supporting this bill and pray that it sees the right of the day, but the government needs to rethink the health sector. Pay doctors well, equip hospitals, and do what it has to do. Thank you, Mr. Speaker.
Member for Gunja, followed by member for Funyula.
Thank you, Honorable Speaker. Honorable Speaker, thank you for allowing me also to air my voice on this bill, the Health Amendment Bill 2024. Let me start, Honorable Speaker, by thanking Honorable Jerry Maina, Kirinyaga County Member of Parliament, for bringing such a wonderful bill. I think it is timely, and as members, we really need to support it. And I think the bill, the amendment measures on two critical areas. That is one, on the emergency treatments at the hospitals and also the retention of bodies in the morgues. Mr. Speaker, from the previous debaters or members of Parliament, it is clear that detaining bodies, one, becomes a bit traumatizing to the families of the bereaved, and secondly, that it doesn't add value, really, economic value, to either the hospital or the economy of the country. Mr. Speaker, I think in making such amendment, it will really go a long way in even helping us as the elected leaders in trying to even manage ourselves. Because realize that, Mr. Speaker, that when such kind of unfortunate events confronts these families, they reach out to us to come out and support them economically. Mr. Speaker, for a family to have one of their own in a morgue basically means that they are so much incapacitated financially. So we really have got no reason whatsoever to continue, kind of punishing them in such a manner. Secondly, Mr. Speaker, I also wanted to air my voice on the issues of the emergency treatment or the emergency services, Mr. Speaker. Mr. Speaker, if you go to most of these hospitals, you will clearly be able to notice a section within the hospital clearly indicated as emergency wings or emergency entrance. And to make this practical, Mr. Speaker, I think it's only prudent if that could also be, can be done in action. Mr. Speaker, there are incidences where you find a situation, for example, where there's an accident and a patient is rushed to an hospital and he or she ends up not being attended to simply because of non-payment of the fee that is required at that particular point, Mr. Speaker. Mr. Speaker, an emergency is an emergency. And in most cases, we would always find you or me or anybody else for that matter not prepared. So punishing one or not able to attend to a patient simply because one is not able to, to make payment at that particular time, Mr. Speaker, is really unfortunate. I think this bill will go a long way in ensuring that we get medical attention because everyone has a right to life, Mr. Speaker. So this bill by my sister, Honorable Njeri, is timely, if you ask me. And we shall support it, and we also ask members of this Honorable House to come in handy and give it the full support that it deserves. Thank you, Mr. Speaker, sir. I beg to support. Thank you.
Thank you. Member for Funyula.
Thank you, Honorable Speaker, for this opportunity to contribute to this Health Amendment Bill 2024 by our colleague, Honorable Jane Njeri Maina. Honorable Speaker, the issue of medical cover, the issue of health, and the rest has remained and always remain a very emotive and at times emotional draining subject any given day. Honorable Speaker, on the face of it and its matters of principle, this amendment is timely, is called for, and could, if well thought out and implemented, probably solve some of the most harrowing experiences many families go through. Honorable Speaker, as I'm seated here, I have received a case of a fellow called Devero, who has been detained at St. Mary Hospital, Langata, since early January. Because of a bill, now stands at 300 and something. The family has raised 200 and something. Unfortunately, by the time he was being admitted, he had not yet paid for SHA. He has been detained, and actually, as a result of detention, he has contracted other illness, compounding the problem that's already compounded. Honorable Speaker, unfortunately, this bill might just be peppering on the underlying issues in the health sector in this country. Because, one, hospitals detain bodies as alien, but many of you, the lawyers, have said a dead body is of no value. They do so because they have spent money to treat that particular patient. Unfortunately, the treatment did not meet the desires of the Almighty God, and the Almighty God has called their person. So we need to look at it from this other side. Secondly, hospitals refuse to admit patients under emergency cases because it will cost them money to treat that patient, and without any deposit or a form of payment, it brings this issue. And that's why I'm saying the bill is well-intentioned, but the elephant lies elsewhere. Honorable Speaker, when you were replacing NHIF, when SHA was rammed through our throat here, it was touted as if it's the panacea, the all-time solution to all problems in the medical sector. We were told there is an emergency medical fund, that if you are faced with an emergency, the emergency fund will step in and get you treated. We were told there is universal health care for those indigent who cannot afford, that the government called Kenya will pay for them so they get medical insurance cover. Lest do we know that it was all a pack of lies, and that's why it has to force the young lady to come with a bill here, knowing very well that it has got a challenge in implementing. Honorable Speaker, and probably it's out of that fear that she has restricted this bill to public sector players. And me and you, Honorable Speaker, we know very, very well the public hospitals that you see dotting all over this country is just hospitals by the name. That's just a mere shell. When you have a proper emergency, a serious emergency, I can assure you, Honorable Speaker, you will unlikely to get that treatment in the local county government hospitals. They do not have the facility, they don't have the personnel. The personnel who are there are so demotivated, they really have no business in saving lives. Honorable Speaker, what's going to happen? An emergency patient will rush to hospital. Whom will we find? Will not even find a clinical officer. We'll probably get a public health officer who has been left in the corridors to take records, or a records officer. Essentially, we might want to bill it as the best bill, but as my colleagues have said, we must deal with underlying fundamental issues. The only fundamental issue that you can deal here is to ensure that every Kenyan of whichever walk in life has a good medical cover to underwrite medical bills. Without this, Honorable Speaker, I can assure you, we are even going to make these hospitals in rural areas to get even worse, to an extent that even when you are dying, you say, I would rather die in my house rather than go to a certain hospital where death is confirmed and it was going to happen. Honorable Speaker, there is a joke somewhere, and I don't want to mention because today is a day of long knives. There is a joke somewhere that you would rather not take me to a certain hospital because if you take me there, I will die. And indeed, many people have died out of negligence, out of nothing. So, Honorable Speaker, the infrastructure required to meet the definition of emergency medical treatment as prescribed by our colleague is not there. And this country, both at national level and the county level, has no intentions at all, or has no desires to make sure that we deal with that matter. Because immediate means the necessary initial or immediate medical care that's administered to a critically ill or injured person to avert or prevent death, disability, unnecessary morbidity, or worsening of a medical situation. If you have a heart attack, Honorable Speaker, in your house, you need an ambulance with oxygen to take you to hospital. I don't know how many ambulances you have in Siaya County. I know in Busia County, they're very countable. I don't know how many. And many times, they may not even have oxygen tanks in those ambulances. So, Honorable Speaker, even by the time you are being taken to that emergency facility, you are already dead. Honorable Speaker, even basics like snake bites, which many times is an emergency case, because if you are bitten by a snake, that's extremely poisonous. By the time you travel from, for example, from Bombay to the nearest health facility at Seaport that has got semblance of a medical doctor, that about 20 or 30 or so minutes, if there is no emergency at the village, you are dead. You are dead. Honorable Speaker, community health volunteers have gone in this country for many months without payment of their dues. They are demoralized, demotivated, have no longer desire to work for the benefit of the people. We call upon, as we pursue this bill, probably it is important, Honorable Speaker, as a country, we need to spend less time on political rhetoric and really solve the problems of this country. Honorable Speaker, the amount of money we are wasting in so many of these endless movements in this country, doing useless things, why can't we pay for indigent so that everybody has got medical cover, has got insurance cover, they can go to any hospital of their choice, get treated in the events of emergencies. Honorable Speaker, there's nothing there can't be anything more important than medical cover. We thought by devolution we'll have solved the problem, but probably we devolve more problems than devolving solutions. I support the bill in principle, but I just want to assure you the long-term objective of the bill will never be achieved until we sort out the fundamental issues bedeviling the health sector in this country. Thank you for the effort and wish you well.
Thank you. Member for Imenti Central, then followed by the member for Teso South.
Thank you, Mr. Speaker, for giving me this opportunity to support the Herald Amendment Bill 2024. And I thank Honorable Jerry for taking this opportunity and to have that human feeling that something in the society has been going wrong, especially when it comes to retaining of the bodies in the mortuaries, of which really it's very tormenting to the families of the deceased. Honorable Speaker, we cannot forget that when it comes to the elderly sector, nobody would wish at any given moment to go through an hospital whereby he is going to be ignored because he has not paid the initial fees for the person to be admitted in the hospital. A number of us, especially those who are in this house, have been called at the root hours. We have been involved in issues whereby a patient has been admitted in the hospital and the treatment has been denied because there is no deposit paid to the hospital. We have notorious hospitals, especially in the Meru region, which are held by the churches and which are owned by private individuals. Mr. Speaker, in those hospitals, even if you have a serious accident or even a snake bite, as my colleague has just said there, and you happen to be taken to those hospitals and you are meant to be admitted, first you must pay some deposit of hundreds of thousands of shillings. And when you don't have them, it means that then your patient cannot be admitted and you have to go around calling for help from friends, from politicians, and the people of goodwill. As for that, Mr. Speaker, we have a problem whereby most of the elderly facilities, most of the institutions which offer elderly or elderly medicines and so on, Mr. Speaker, they are owned by individuals and they are operated as business enterprises. And as for that, I don't know how this bill is going to be coined to an extent that is going to be binding to them, for it can be binding to the public sector, public hospitals, public health centers. But when it comes to the private hospitals, generally, private hospitals are created for business purposes. And those who operate those hospitals, if you look at it keenly, you see that their interest is not according to provide health facilities is not according to them. It's just for purposes of making profit. And Mr. Speaker, that's why they insist on having deposits before treating somebody. As it is envisaged in this bill, It's a wonderful bill, especially where it comes to a place whereby one is to be find a certain amount of money for failing to provide initial treatment or providing initial care which is required to save life. For the person who is being taken to the hospital or the person who is being sent to be sick, he is unconscious most of the time when they are taken to the hospitals. And maybe it's the only person who has access of the money which can be able to be paid as the initial deposit in the same institution. How is that person going to release that money so that he can be treated or he can be saved to be able to operate the account and get money to pay to this hospital? I call upon the mob of the bill to see to it, of which it should come in the form of amendment at the right time. We separate private institutions and public institutions. It's very necessary. But when it comes to retaining of the bodies, I've been in practice as a lawyer for more than 25 years, and I know very well that it is a declaration of the court that there is no variation, there is no value in a dead body. Even if you see our people competing to bury a body, it does not value, it does not add value either to property, neither does that body become a property at any given moment. So what it is that to retain that body in the mortuary so that you can be paid whatever the treatment cost which was incurred by the time that person was in the hospital. Sometimes you wonder what value does it hand to the hospital? But the question is, why not to use a collateral? Why not to use a collateral so that at least it can operate as a shock absorber or something which one can hold, maybe a title deed, a logbook without complications, provided that it is pinned to the family of the deceased, and then that collateral can come to be redeemed their own later when the required amount is paid in the hospital. But further still, Mr. Speaker, it then brings complications of the people who have operated or who have litigated on cases of hospitals negligence. For sometimes an hospital becomes negligent, it treats somebody in a bad way, or it operates on somebody and out of the negligence of the doctor. Like a doctor whom we were told that he was operating on a lady, cesarean birth, and he remembered that he had left friends in the bar. He left the patient on the operating table, went to finish the task he was taking, and by the time he came back to the theater, he found that the lady was dead, and the child who was meant to be born was dead. That patient was retained in the hospital because the hospital wanted to be paid their fees. Yet it was the hospital which was negligent. So there is a lot which there are intricate issues which are meant to be addressed in this the bill, especially when it comes to the retaining of the bodies, because if it happens that it's the hospital which was negligent and it caused the death of a patient, yet the hospital will retain that body until you pay, then it costs a lot to be considered. For at the end of the day, this hospital, unless it is taken to the court through a legal procedure to compensate the family, is going to be a beneficiary of the crime which it has committed by having a doctor who is negligent, having the patient die, and then at the end of the day, being paid for the crime which it has committed. And you know how long it takes in the court corridors to have a compensation of a patient who has been admitted, taking into account that the witnesses are going to be other doctors. So, Mr. Speaker, I support this bill to an extent that on a principle that there is no value in the dead body, even if it's kept in the hospital. Our people are to be informed that even if a body is buried in the hospital, if the hospital refuses to release it, there is no value in the same. I therefore support the bill. Thank you, Mr. Speaker.
Before you sit down, I've heard this a lot, and we're coming to the end of this discussion.
Yes, Speaker.
I've heard these things as sat here, that there's no value in a dead body.
Yes.
So why are we struggling to get them buried? Because there's cultural value.
Speaker, it's the law.
Order.
It's the law which has been declared by the High Court
Order.
and the Court of Appeal.
Order.
It's only the Supreme Court which I have not, and it's clearing the same.
Order.
But
Order. I'm just asking this. I'm not finished. So why are you struggling to get these bodies buried? Because as a people, as Africans, culturally we believe that we should bury our dead. Right? And I've not heard anybody talk about it.
yes, Speaker.
The families are struggling so that they can have cultural closure. And I think most hospitals, most doctors miss this. The courts may have said what they said, which is true, that in terms of holding the body doesn't add value. But for families who are bereaved, culturally, and this has to be insisted upon, culturally, we want to bury our dead in a decent manner. And that's why people, last weekend I saw a family in Nyeri burying a log
Yes.
because one of their own disappeared in Afghanistan, can't be traced. There's cultural value in doing burials. And I think this is what is missing all through. I think I've had almost 30, 40 submissions. There is cultural value in us burying our bodies as Africans. Honorable Kim, I think you are finished.
Speaker, no, I will not finish. When you have addressed it in that form, may I put it in the legal circles when it comes to the ingredient of the word value. Value is whereby it can be valued in form of either material or monetary term. But Speaker, this one is just moral. It's a moral obligation to see that you have buried the body. It's not of any material, neither of any form of material or monetary value. It is none. Because, Speaker, you find that families are struggling to bury the body so that they can claim inheritance to say that we are the one who buried our father and we are entitled to a better inheritance or all the inheritance. And that should not be the case.
Thank you.
At all.
Thank you.
That's all, Mr. Speaker.
Certainly, people don't bury because they want to get inheritance. Certainly not. Certainly not. People bury, people go out of their way to borrow millions of shillings because they want to respect their dead. It's as simple as that. The Honorable Mary Omasa, you'll have 4 minutes. And let me just finish. I'll add you one that I'm going to take. Then after that, the member for Parliament for Kirinyaga will reply. And during her reply, she may, give a minute or two to the Honorable Nyakundi and the Honorable Ikiara, who has sat all through this afternoon and didn't only put her card 4 minutes ago. The Honorable Omasa, go ahead.
Thank you, Honorable Speaker, for the opportunity. I think from the onset, I want to congratulate my sister, Honorable Njeri Maina, for this very well-thought bill that is before us. Honorable Speaker, this bill seeks to give constitutional teeth, legislative teeth to the Constitution, the right to emergency health care, and also to safeguard the dignity of the dead, as provided for in Article 43(2) for the right to emergency and 28 for the dignity, safeguarding the dignity. Honorable Speaker, from the onset, I want to say that, to echo what other leaders have already said here, that everyone has a right to emergency medical care, regardless of their financial status. And therefore, any delayed attention or medical care to any Kenyan can lead to severe medical condition. Having said that, Honorable Speaker, I have seen women die while giving birth, giving life, resulting from delayed attention. And some of them give birth to children that some children may survive, but mental conditions. And therefore, that begs the question. Sometimes I wonder, what happened to the ethical and medical obligation by medical practitioners? Because healthcare providers are bound by ethical principles to give emergency attention to all patients, regardless of their financial status. So the mandatory requirement for deposit should never deter them or bar them from giving attention to any patient that goes to these hospitals. Because this delayed medical attention, Honorable Speaker, has far-reaching implications. has severe public health implications. For example, if it is an infectious disease, like COVID that we experienced 2020, 2021, immediate attention would have led to prevention. Can prevent this severe spread of infectious disease. It may even reduce the cost of treatment or effectiveness of the treatment, as opposed to if this treatment is delayed. So timely treatment or attention, Honorable Speaker, cannot be gainsaid. Thirdly, Honorable Speaker, we know that it is a government responsibility to ensure there is access to health care to all Kenyans. And I want to first applaud the government for the introduction of the SHARE program. Just the other day we had a meeting and we were briefed on how it is being improved. But we must also emphasize that there is need to resource the hospitals and improve them so that we have this quality health care to all our people. And as I conclude, detaining patients, it's not just detaining bodies. It's not only detaining bodies. Honorable Njeri should have added even detaining patients. I've had to deal with cases of detained patients in my constituency. We need to find a way, because this is inhuman and it puts the families into a lot of trauma, and therefore alternative means of payment of these bills needs to be found. And I think that is what the bill has not addressed. We must also look at the other side of the coin. The hospitals, and you know the nature and the culture of Kenyans. People will just decide to take their relatives and their kin to hospital and refuse to pay bills, just because there is a bill that has removed the detaining and what have you. So what is the bill saying about how this bill should be recovered?
Allow her a minute.
Honorable Speaker, probably the bill should also address and put responsibility, say probably to the Minister of Health, to SHA, to accommodate these bills once it is ascertained that this family is vulnerable, cannot completely afford, because no kin would want to leave their dead body in a hospital and refuse to pay if they have the money. I think that part of the story needs to be also, that conversation needs to be addressed in the bill. Thank you, Honorable Speaker.
Honorable Jane Njeri Maina. This is your...
Thank you, Honorable Speaker. Honorable Speaker, I'd like to thank the many members who have contributed to this bill, enriching the debate and giving a human face of their constituents' lived experiences.
Are you going to donate any minutes to Honorable Nyakundi and Kiara?
Yes.
Please,
yes.